Hey, everybody, good morning. And thank you for joining us to the second annual OC Community Cares Forum. My name is Sean Weehan, and I will be your host this morning as we begin to tackle what is becoming quickly a post-COVID-19 reality. The idea behind the annual OC Community Cares Forum started last year when COVID first came upon us and quarantine was everybody's reality. And we wanted to get a perspective from various different pillars in the community, various different leaders that are heading up various sectors. And we decided, why not have a moment in time snapshot of having everybody just jump on a quick call on a Friday morning, and let's just give 5 to 7 minutes to hear everybody's thoughts on the current challenges that they're facing in regards to COVID-19, where they need help from various different community pillars, and if they see any hope. And we did that last year, and we thought it was a great event. It was moment in time, a snapshot of where we were at. And we wanted to do that again a year later. So here we are a year later. It's been a very difficult year for our community, for our nation, and for our world. And we still aren't out of the woods yet. And we wanted to hear from, again, another group of pillar leaders, 7 leaders in the community, to share with us a little bit about what it is that they're facing right now. What are the current challenges as we're coming into a post-19 world? Where it is that they need help from all the different members of the community, and ultimately, where are they seeing hope as we move through this? The format for this meeting is we have 7 presentations that have been pre-filmed, but the filming has taken place over the last 7 or so days. It is very relevant, and every presenter realized that they would be speaking to you this morning, to all of our various different leaders in the community. So it's very relevant in terms of them addressing you and how you can help and how you can understand their current challenges. And really, we wanted to bring in the idea of hope, because I know every one of us needs hope in our lives as we continue to move through this very difficult time in our community. So the format will be an introduction of the pillar and our presenter, followed by me pointing out some of the key points that they discussed during their presentation, and then we will transition over to the next pillar. Each presenter is speaking somewhere between 5 to 7 minutes, and their presentation was edited down to match that time slot. So we're going to begin now with our first presenter, which is most obvious, the pillar of health, Jenna Jensen, who is the Chief Government Relations Officer with Children's Hospital of Orange County. Thank you, Jenna.
Thank you for that question. Post-COVID, definitely getting people vaccinated is on our minds. And I think the state is doing the right thing to prioritize and really incentivize diversity, equity, and inclusion, and specifically equity in the distribution of vaccines out to the population. So making sure that our neighbors in lower socioeconomic status, zip codes in the state, are getting access to vaccines, and prioritizing that, and also incentivizing by telling everyone in the state that when we hit certain thresholds of getting people vaccinated, that they're going to make it easier for businesses to open up. So that's a great incentive. So in the meantime, we got to continue wearing masks. I got mine sitting on my desk. I know we're all tired of it, but we've got to keep wearing those. We've got to keep being mindful about staying distanced and all that until we can get more people vaccinated. So I know that the Biden administration has said that their goal is by May 1st that all adults will be able to get vaccinated. So that is a fabulous goal, and let's hope that that happens. And then for CHOC, we're really tracking on when children will be able to get vaccinated. So those vaccines haven't yet received FDA approval for pediatric use. But I know they're working on that, and we're excited about that. And we are now looking at helping schools to get vaccines out to educators so that schools can reopen safely. So CHOC is playing a role in vaccine distribution to the adult population, specifically with educators and also with parents and caregivers of children who are patients of the regional centers, which is certain medical diagnoses, technology-dependent children and children with other complex and chronic health conditions. So now their parents can get vaccinated if their children are receiving care through those regional centers. So vaccination is a really big thing. The other impact that we're tracking on very closely that I know everyone is the mental health impacts of this pandemic. we have seen very dramatic increases in demand for mental health services. People have been experiencing anxiety, depression, suicidal ideation, self-harming behavior at much higher levels than we saw before the pandemic. We've seen it in our emergency department. We've seen it in demand for our inpatient unit and for our outpatient programs and demand for therapy services. And this is not unique just to pediatric patients and adolescent patients. We're hearing this from our adult partners as well. So I think finding ways to invest in mental health infrastructure so that we can really make sure that people who need services can get access to those is going to be extremely important coming out of this. And probably for the next 5 to 6 years. Honestly, we're going to see lasting impacts from this pandemic, and we're going to need to be finding out how we can increase the availability of services. There was some funding in the relief bill that the president just signed at the federal level for mental health services, and also the governor is looking at including that in the budget for next year. These are all good signs, but those are a drop in the bucket. We're going to have to really invest in that. I would say thirdly, a lot of hospitals have had negative financial impacts from COVID. Supplies were more expensive. Volumes were down in the outpatient settings. We're going to have some recovery to do ourselves, and we're already working kind of toward that, but it's been a very tough financial year for CHOC, and I know for other hospitals as well. So that's something that we're going to have to be recovering from. And also it'll be interesting to see what the shift to telehealth means for the healthcare delivery system. I think that there are certain services that people have really enjoyed getting through telehealth, and we're going to need to see how we can continue to deliver some services via telehealth while some services return to in-person. So those are some of the issues that we're looking at. So looking out into the future, so what do we need now and what are we looking at going forward and what keeps us going? So what we need now, as I've said, we need the community to join us in really looking at ways that we can partner together. And I would say mental health is a huge priority, as I've just described, but the community can help us with that. CHOC is looking to partner with the county, also with Be Well, which is an organization, a public-private partnership that many of you may have heard of. We're talking to other adult partners. We're talking to our partners up in Sacramento and in Washington, D.C., but our whole community can come together and help us find ways to fund those services. So that is something that I would say, let's all look at that. Let's all look at how we can help other people's mental health just ourselves. So reach out to friends, reach out to family, check in with people, take it as a challenge to pick up the phone and call someone you haven't heard from in a while and see how they're doing. It's amazing what a difference that can make in someone's day. So we can all help improve everyone's mental health by taking care of one another. And I would say that's really important right now. And we're going to need that to be resilient and get the work done that we need to do to move forward. So what gives me hope? I would just say the relationships that we have in this community, the partnerships that we have, everyone's desire to move forward stronger and smarter and better than we were, and everyone's desire to be able to be back together again and support one another. I really see that. I really believe in that. I know we can do it. So that does give me hope. And every morning I wake up and I think, all right, I'm going to go in and do some really good work at CHOC today, and I'm going to get to work alongside people who really want to do good work too. So that's the thing that gives me hope. I know that's what gives us hope at CHOC, and I know that's what's going to keep us going as a community. So thank you.
Thank you, Jenna. We've had a lot of people join us over the last few moments, and I want to thank you and welcome you for joining us this morning for the second annual OC Community Cares Forum. We're a year into a very different reality here in our county with COVID-19, and we're still struggling with some of the new technologies that we have. So I want to thank you for your patience and trying to maneuver through the various different webinar forums with Zoom. We were able to get Dave Elliott on the call here onto our webinar. So Dave, if I could introduce you real quick, you could say a few words before we go into our next pillar. Dave Elliott is the CEO of the Paskey's Foundation and President CEO of the Santa Ana Chamber of Commerce. Good morning, Dave.
Good morning, Sean. I overslept. No, just kidding. Just kidding. I didn't oversleep. We just had some technical problems, but I wanted to just thank you and give some for partnering with the Paskey's Foundation, the Institute for Community Impact this year for our second annual OC Cares Forum. And we have an outstanding group of 7 speakers. I know most all these people and they're outstanding leaders. I want to thank them for their dedication to making a difference in our community. And I want to especially thank Bank of America for sponsoring our forum today. Lisa Sims and Sherry Battle, 2 great friends to the Institute, and to give some. So I want to thank Bank of America and for their contribution to make this possible today. I do have one kind of announcement I'd like to make. We are having our influential leadership breakfast coming up on May 5th. You can go to paskeys.org and get information about that. We'll be highlighting our 38th organization that we're presenting since 2016, and that's the Latino Youth Academy. And so we're excited about that. So we hope that people will join in on May 5th for that event. And I think that's all I really needed to share right now. It's great to have all of you joining us today. And Sean, again, thanks. Shout out to you and your team for putting this together. It's great to always partner with Gibson. So thanks a lot. Appreciate you.
Thank you, Dave. Great to have you this morning. So we just heard from Jenna Jensen with Children's Hospital of Orange County. She focused on 3 primary things in terms of current challenges: 1, vaccinations; 2, mental health; and 3, the negative financial impact that has happened because of COVID-19. She encourages all of us to help each other with our own mental health, and that her hope is that we'll see the light at the end of the tunnel on the other side of this as we continue to work towards these challenges as a community and together. We're going to move on to the next pillar, which is the pillar of education. We have Dr. Al Mijares, who is the Orange County Superintendent of Schools, to share with us a few words this morning.
That's a great question, Sean. In terms of moving to a post-COVID-19 world, what are the challenges? Well, many of the challenges will remain the same. In fact, they may perhaps even intensify. Remember, this is the greatest health problem that we've had in our lifetimes affecting our public schools. It has required enormous communication with a number of entities, all of our stakeholders. We've had to work with the California Department of Public Health, the California Department of Education, the CDC, and the information changes weekly, if not daily. So it's been a difficult time staying on top of the information. I'm very heartened, though, that we have worked closely with all of our constituents, all of the stakeholders that have a say in the public school system. Remember that here in Orange County, we've had over 4,000 deaths and about 267,000 people that have been affected by the virus. So it really has been a tough thing to navigate. People tell me, hey, you're getting circles under your eyes. And it's because it's a 24/7 thing. I mean, it's not uncommon for people to wake up in the middle of the night and consider, you know, what should I do here? What should I do there? And how can we protect our students? Because that's the essence of it. And it's maintaining the safety of our students, their families, and all of the people that serve them, you know, and knowing how to just how to create a learning environment that is healthy. I think those things are going to continue to remain with us. So while some things might change radically, other things won't. I also think that we have a challenge to continue to offer not only in classroom instruction, which is preeminent, that's the most important way to educate our students. They want to see their teacher. They want to see, you know, have eyeball to eyeball communication with their teachers. They want to be around their peers. They want to be in a really thriving, healthy learning environment. That's all important, but we've also recognized the power of technology through e-schooling, through video conferencing, being able to provide information to students that is fluid. And you know what's great about it is that we introduce concepts in the classroom, but those concepts get reinforced at home through homework, and they also get reinforced through the use of technology. And everybody has technology in one way or the other. You have phones that are in our hands 24/7, it seems like. There's, there's Chromebooks, there's laptops, there's iPads, all kinds of ways to stay connected. That's going to continue to fortify the learning environment. In terms of urgent help that we might need, and I believe Orange County is a benevolent county. I remember when I was the superintendent of schools in the Santa Ana Unified School District, and I had actually businesses that were in the, let's say, south part of the county who cared about Santa Ana Unified, and were wanting to help us. The important thing is, because we're a benevolent county, it just means that we want to help each other in this county. We have volunteers. We, as the Orange County Department of Education, working with our healthcare agency, we have done our own pods, which is a distribution center for the vaccine, and we have vaccinated the education sector. So we have several of our districts have at one point or another opened a distribution center for the vaccination process, and we have vaccinated over 15,000 educators, teachers, people in support positions to the classroom, and we're very excited about that. So we've come together. We have also cooperated with FEMA sites and with a number of these multi-community entities like Walmart, CVS, Rite Aid, Albertsons, Costco. There's a number of these locations, these companies that are also part of the vaccination process. And we have worked with the super pods that were established by our county. And that is really born out of a spirit of love and commitment and care for one another, sacrificing for each other. So I'm very optimistic about that. Also think what we're trying to teach our students, and what I think their students are learning, is the need to have a growth mindset, to understand that adversity is a part of life. You will experience catastrophic or cataclysmic experiences in life. And we have to teach our kids to have the grit, the resolve, that despite that, hey, power through it. That's going to help you get stronger. In fact, that's the whole process of building muscles, right? It's that active resistance. And they need to build the kind of muscles that will help them emotionally and socially to handle the stress. And by the way, when you think of 21st century learning skills, what people are saying the workforce needs most, yes, we need the cognitive and creativity skills, but we need to have those other skills that deal with communication, collaboration, with people that may be experiencing hardship, but you know what? They don't let the hardship rob them of their joy. They continue to stay centered. I do want to end with a quote by Lincoln. It's one of my favorite quotes, and it has to do with civility and, more importantly, with kindness. Kindness is the only service that will stand the storm of life and not wash out. From Abraham Lincoln.
Okay, thank you, Dr. Almijares. Speaking on the pillar of education, he touched on a couple different things in terms of their challenges. First, the daily communication that they're getting from both local and national level. The challenge is to create a learning environment that is healthy and using new technology. Those are their challenges. In terms of what they need from us, volunteering and potentially getting businesses involved. That has been a huge factor for them in their success over the last year, is having lots and lots of businesses engaged with what is going on at the school level. And finally, the idea of hope here, adversity from this, that the students are learning. They're learning adversity, which will help them in the future and help them in the 21st century to overcome what we're experiencing right now. We're going to move on to our next pillar, which is the nonprofit pillar. Tim Strauss, from President and CEO of 1OC, is going to be speaking to us about what's happening in the nonprofit space.
It's a great question. And one of the things that I did want to share is, as we're thinking about the nonprofit sector, is just how amazing this nonprofit world has been, especially in Orange County over the last year in responding. But there definitely are challenges. I think one of the top challenges is we're still dealing with uncertainty. Whether that uncertainty is how do we respond to the community, looking at how do we scale up or down? What are our financials? How do we sustain ourselves? But I think that the big question is when do we start shifting from where we've been to where we're at today? And I think organizations are at completely different places based upon their readiness and also when they feel they can respond most effectively to the community. I think a couple other things that really stand out is that the growing needs are almost insurmountable in Orange County in terms of what needs to be addressed to help on our road to recovery from the pandemic. We're still in the pandemic, but the nonprofit sector is critical, I believe, to responding to these needs. These needs are not slowing down; they're actually escalating. And I think the sector that's probably best equipped to address a lot of these issues and working with the private sector and government is the nonprofit sector. So I think that the ability to keep up with the demands in our road to recovery is also another critical challenge. I think the third is there's been a lot of downsizing, but there's also been an opportunity for professional development and our volunteer leaders in our nonprofits to really step up. But I think there's great challenges along with opportunity, but great challenges in terms of what does that look like? How do we equip our staff and our boards to most effectively respond to this road to recovery and addressing what needs are critical to their organizations? I think that if I were to say in one word, what nonprofits collectively, when I've spoken with a lot of nonprofit leaders over the last year, it's resources. It's resources in terms of, it's not just financial, though financial are really important. I think we have a little bit of a disparity between those organizations that are getting a lot of funding and those that may be on the periphery and maybe are not part of those that are on the frontline organizations addressing what we perceive as critical needs, but are still very important issues that need to be addressed in Orange County. I think that resources also apply to different skill sets and knowledge and the ability to get actually volunteers. And volunteers are being looked at differently, not just in terms of folks that are in-person hands-on volunteering, but those that can bring some skills in a variety of different areas to help our nonprofit organizations move to what the next stage is of our nonprofits, which I think are quickly evolving and changing based upon this pandemic. So I think that if I were to sum it up in one word, it's nonprofits need resources in a variety of areas. Much like before, the nonprofits have always needed resources, but I think now more than ever, the ability to have individuals, companies, government agencies, funders to really look at how do we help equip and partner with our nonprofits to really address these needs. Our nonprofits need more resources. If I were to, think about our nonprofits, and I look back to, and this is completely different in 2008, and the challenges and a downturn in the economy, there was a projection that we would lose a significant number of nonprofits, and that didn't come to fruition. I saw projections last year in July that we'd lose 30% of our nonprofits by this fall. I haven't seen that as well. So when I think of our nonprofits, and what gives me a lot of hope is I'm going to break this down into what I call the 4 R's. And that is our nonprofits are extremely resilient. They're very adaptable. They've always been able to work quickly on their feet. And I think I'm seeing that now more than ever. So I'm really excited about that. The second R is resolve. That our nonprofits are so committed and dedicated to addressing these needs and thinking of new ways of how this can be done and partnering and looking at collaborations in ways that maybe weren't thought about before. The resolve that our nonprofits have has been truly astounding. The third R is reimagining. Nonprofits that I've seen that are really on the forefront of all this have really taken a hold of reimagining what their organizations can be, how they can deliver their services more effectively. to deliver on their missions. And it's been astounding and also uplifting to hear so many great stories of how nonprofits have shifted so quickly. And the fourth is around recovery. As I said earlier, I believe that the nonprofit sector is critical to our recovery efforts here in Orange County from the pandemic. And I think we have some amazing nonprofit leaders and staff and boards that are willing to take the lead and open to new ways of thinking about how they can do things. And I think that's what sets our sector apart, which is so amazing, is that ability to collectively take those 4 R's and work together to see what does it mean for Orange County, not just now, but moving forward. So I'm really excited and very hopeful and inspired by what's happening with our nonprofits in Orange County. And I look forward to working with them in the days to come.
Thank you, Tim. Once again, Tim touched on the challenges that are happening right now as we're transitioning to a post-COVID reality. Organizations are at different stages throughout the nonprofit sector, and the recovery needs are growing. There's needs that are coming on every day as we are coming out of this particular period of time, where volunteers are needed that are skill set volunteers that can address these new challenges that are growing. The nonprofit sector needs resources right now. It's both dollars and skilled set volunteers, again, to address the challenges. And Tim is seeing hope in the sense that we haven't lost 30% of the nonprofits in our community. We have seen nonprofits that are resilient, that have resolve, that are reimagining how to do their mission and vision within this community, and that we will see recovery. And that is beginning to happen as far as Tim is concerned. So thank you, Tim, for sharing a little bit of what's happening in the pillar of nonprofit. Moving over to the pillar of arts now, we're going to hear from Casey Reitz, who's the president of the Segerstrom Center for the Arts.
Sean, I appreciate it. There's certainly a lot. I mean, this pandemic certainly flies in the face of everything that a live performing arts organization does and does well. I mean, we come together, we sit in crowds, our performers come together, whether they be singers or dancers in close quarters. So it's certainly a challenge. And I think that, you know, one of the things that that we've been worried about is when can we get back to 100% occupancy, because there are a lot of different kind of performances types, large Broadway, international dance, that we really can't do, or the financial model doesn't work unless we can come back at 100% capacity. We're certainly encouraged by the direction which the vaccines are going, and we're certainly thrilled that Orange County in particular, and California in general, is moving nicely through the tiers. And so we're optimistic that if the notion of having our independence from COVID happens around July 4th, which is what Dr. Clayton Chau has told us, and President Biden has told us, and also that you know, that'll help eliminate social distancing so we can come together in full, that's really what we're looking for. Our companies want to come to us fully vaccinated. They expect our team, our backstage team, to be fully vaccinated, and we're working on that and think that that's very achievable. So just looking forward to gaining people's trust, helping them to feel safe about coming back into the building. And there's a number of things that we've done on that front to achieve that. But otherwise, you know, we're just remaining optimistic and feel that we might be just a few months, maybe 6 months away from being out of this. Well, that's an excellent question. I'm really glad you asked that, because there's really two things that we're looking for right now. The first is we desperately need guidelines for the performing arts from the state of California. If you pay any attention to those tiers, the purple to yellow tier, when you get to the yellow tier, it says concert venues closed, live theater closed. So we don't really even have a roadmap from the state about under what conditions will we be allowed to open. And, you know, we're not naive. We're not trying to open a 3,000 seat theater tomorrow, but we would like to know and understand under what conditions can we do that, because we have significant lead time to pull off what we need to do. We can't simply just take about a week and call the staff and bring them back in. And because of this crisis, we've been forced to lay off furlough about 63% of our staff, and everybody else that's working here is working under a pay cut up to 25%. But when you talk about big Broadway productions, opera, dance, we need about 6 months of lead time to be able to pull the teams back together, get the tickets on sale, and have a chance to really bring in an audience. So we really need the state to give us guidelines for that. They've given guidelines to almost every other industry or activity at this point. My understanding is the outdoor performance guidelines are coming out today. Hopefully the indoor guidelines in a couple of weeks, and that's what we're really looking forward to. The other answer to the question is funding. We rely on about 75% of our revenue to come from ticket sales, and with a pandemic like this, that number's gone to zero. So there are efforts underway at the federal government. They approved the bill called the Shuttered Venue Operator Grant, and we're looking into that very closely to help alleviate some of the deficits that we're going to incur both last fiscal year and this fiscal year. That'll give us a big leg up and help us bring our staff back. They've been out of work for a very long time, and we'd like to put them back to work. Yeah, I mean, this time, like I mentioned, it's been such a dark time for the performing arts because the pandemic flies in the face of everything we do. So it's always been about how to remain optimistic, how to remain good humored, and be reminded that we will come back. And I think that the idea here and what we've been hearing from the community is that we're probably valued now more than ever before. People are tired of being stuck at home. They're tired of Zoom, Netflix, Hulu. They want to get back out and see people and see live performance and have a social experience. So I think what we offer to the community is valued more than ever before, and people are hungry, really hungry to come back. And that was something that occurred to me when the pandemic first started that would happen, and it seems to be playing out both in what we're hearing from our audience anecdotally and through a lot of the data that we've been doing through surveys. People are eager to come back, and they're ready to come back as soon as they feel safe, and we feel like that's right around the corner. So that's what gives us hope.
Thank you, Casey Reed, speaking from the arts pillar. Couple different things. He spoke on gaining trust for people to come back into the environment of, closed quarters, being in a theater, being right next to each other, and needing to do everything they have to do to make people feel safe in that environment. In terms of what they need from the community, they need guidelines. They need a roadmap as to how to open back up. And they need funding, both from tickets and from the government, if possible, to keep them afloat during this particular period of time. But Casey is hopeful that more than ever, people want to gather and want to go to live performances. And that's giving him hope. And Casey, we wish you lots of luck as we move into this, what will hopefully be a more open world in the coming months. Switching now to the pillar of business, we have Lucy Dunn, Chief Executive Officer of the Orange County Business Council.
I'm delighted to join you this morning. It is post-COVID. When you look at our biggest challenge, it isn't COVID, it isn't the economy, it isn't China or the global connectivity. Candidly, it's a lack of trust. When 20% of Americans trust the federal government to do what is right just about always, 20%. When 84% of Americans say politicians have too much power and influence in our economy, when 67% of Europeans say Europe cannot always rely on the US, and 56% of Americans believe journalists and reporters are purposefully trying to mislead people. Trust is our number one problem today. And I think we need to work on that one and work on it hard. I think that the most urgent need of business in general is not what business needs, but what business has to step up and do for others. And in an era of trying to rebuild trust, business must communicate directly, truthfully, and often. They are now more trusted. Business is now more trusted than political, media, or non-governmental agencies, thanks to pandemic straight talk. And trust begins with truth. So I do believe we really do need to step up and continue to speak. And on top of that, business is being asked to take on far more than we ever were expected to take on before. We're being asked to take on solutions to social problems that typically government leaders would address, including climate change, including meeting the demands of a new digital economy and crossing that digital divide, making that digital divide less of a division for all. So those are the things we need to really be looking at, and business needs to step up. CEOs need to step up, because candidly, if you are not watching what's happening around you, it's going to affect your business bottom line. So engage early and be the leaders that I know you already are. What gives me hope is an acceleration of the digital transformations that are right now improving the world. Things that we would not have seen for 30 years actually have happened now today. And those include, for example, healthcare. We do like to see our doctors in person, but telehealth has been a major game changer for folks. We don't have to be sitting in a doctor's office to see our doctor for routine care. Sometimes we can just communicate, and the medical profession has picked up on that. Our research, exponential growth and ability to develop vaccines in record time, to develop good research to move us forward. Wellness and fitness, really important to understanding the how health is connected both mentally and physically to being a good workers. Education, we all know we hate Zoom school, but in many ways it helped. That hybrid method helped. And just naturally always having children in seats in a classroom, that's important. The connectivity of children to a teacher is important, but experiencing the ability to explore in real time that information is right there on your computer that you can access. I think education has definitely benefited from it. And certainly there's nothing like a great pandemic to expose systemic flaws in government. And we saw that in their failure to deliver on economic development, benefits to people, EDD, unemployment benefits, really, that just was a complete failure from state government. So watch systemic changes and how those things really do ramp up, particularly with technology. So as tough as COVID was, that 30-year jump to that digital transformation, I think will really help our future and help us all be more productive and healthy and effective in getting our work done.
Thank you, Lucy. Again, Lucy touched on the challenges of overall lack of trust that is in all the sectors that we have right now. And she brings up the point that business, despite the lack of trust, seems to be more trusted than others, and CEOs need to step up, business leaders need to step up and to deal with the challenges that are before us. She has hope that technology will continue to accelerate as it has over the last year in the field of healthcare, research, wellness and fitness, and education, as well as systemic changes that may happen in the government sector because of technology improvements. Moving now on to the pillar of faith, Father Steve Salat, the pastor of Our Lady Queen of Angels in Newport Beach and the current president of Mater Dei High School. Father Steve.
Well, we're still definitely moving to a post-COVID-19 world, Sean. We don't know exactly what that's going to look like. So my reflection on that to this question would be simply, how do we become more comfortable with the unknown and the uncertain and the unclear as we go forward? Because there is no real roadmap that's laid out for us, either by government, by church, or by community. But I think the underlying thing is to remember that ultimately this is for the common good. And I think I always go back to that, is that this is about the common good, not about my personal preference or attitude or belief. It's really for the common good. And I think when we do best together as church or a state or as a school, it's that commonality that we kind of focus on and kind of always go back to in case we get off track. I think a couple of things have become really obvious to me. One is mental health for people is a lot more fragile than I think we thought it was before the pandemic. I think as a church, we've begun to reach out in new ways for mental health. It's really a big issue here at our school. Matter of fact, we created a 4th position this year of an assistant principal just to deal with student health. And that's a whole new reality that I don't think we had that to some level in parishes and schools, but it's really become much more intensified and expanded. I think the other thing is, honestly, and it's probably a reflection on my own health, the physical health of our country is a lot more fragile than we thought it was. I mean, how many times have we heard they had COVID issues, but the real issues were underlying? So the person didn't die from COVID, they died from underlying issues. And it just is a reminder to me, and that's been young people, older people, middle-aged people, that physically as a nation, despite all the prosperity that we have as a country, our physical condition is not nearly as good as we probably thought it was. So that's kind of an urgent issue that we need to face. I think the other thing is just family, I think, has become much more of a conversation for people. And what does that mean? How do you define family? However people define it, I think people have kind of gotten regrounded in the sense that this is an urgent thing. We don't like living in isolation. We don't like being separated. We don't like the distance between us. We need to find new ways to reconnect and be regrounded in what really makes us human. And in part, that's family, as church, as school, as our own real families that we live with or are connected to. That's a great question because that leads us into the future. What are we looking forward to? I would say new partnerships. We developed new partnerships with mental health agencies here at school. Our diocese is connecting more deeply to different outside organizations that can really help us and reach our communities. I think one of the great things as far as church goes, being a Roman Catholic priest, I'm very used to laws, canonical laws, liturgical laws. One of the great things is we've been able to say, what do people need? Not what does the law say, but what do we need to help people? What do we need to connect to people? And really, in many ways, our church has kind of put a lot of those things, those prescripts aside for the sake of what do people need to experience. So that's a great thing. And what I found in the parish on a personal level is I've had amazing people come up to me that I never thought would say this, simply say, what can I do to help? And especially as we open back up, that's a real question that's coming forward. And I'm delighted at that on an individual and on a collective conversation. I think the other thing for us is simply communication. Typically in schools, we send a bulletin or an email out. We're communicating in all sorts of new ways. The same with church. Typically it was bulletin, and send that out a weekly. We have so many different levels of communication because people have learned all those new different variety of ways of communicating. And we need to piggyback onto that as a way of communicating with our communities. And the last thing I would say is resilience. People are amazingly resilient. Communities are amazingly resilient. And that says something to me about the toughness and the strength of human nature. And that's been a great gift as I watch people being excited to be in school, as sports have opened up. People are excited again just to be together, and that gives them hope. The second is we come back into church. People are excited because it gives them hope that we're coming back together. So resilience is a real image or something that I'm really experiencing in people.
Thank you, Father Steve Salat. Father Steve spoke to the uncertainty that we're all experiencing right now. And despite the uncertainty, that we all need to be working for the common good, that this is not about us individually, it's about us as a collective community and doing the things we need to do collectively to move through this. His concerns right now are dealing with mental health and the needs that the community members have to address this issue of mental health. Not only mental health, but physical health and our own physical beings dealing with this virus. And finally, the idea that we've been separated and that we need to reconnect, whether that's in our church, in our families, or in our community. That's something that needs to happen in the coming months. Finally, he's hopeful that people are asking, hey, what is it that I can do to help, whether that's at the church level or the community level. He's also hopeful about the communication that has now come out of this period of time. We have so many more ways to communicate, and that ultimately people are resilient. And he's seeing that resilience in his parishioners, in the students, and in the community that he's a part of. So thank you, Father Steve, for that. Moving on to our final pillar of government, we have Supervisor Andrew Dee, who's the supervisor of the Orange County 1st District, who's going to give us a statement related to COVID-19 and the transitions that are taking place.
Hello, this is Supervisor Andrew Dee, Chairman of the Orange County Board of Supervisors. I have the honor of representing the 1st District, which includes the cities of Santa Ana, Garden Grove, Fountain Valley, Westminster, and Midway City. I want to begin by acknowledging that every one of us has been impacted by COVID-19 in some way. Thousands of our small businesses, childcare providers, schools, and restaurants have struggled under the state's closure orders. Our friends and neighbors have suffered greatly at the hands of the virus. Too many have lost their lives. But while COVID-19 has been devastating, it hasn't diminished our collective spirit. In these tough times, Orange County has pulled together. We have supported each other, helped one another, and found a way to make it through. As supervisor of the 1st District, I understand the unique needs of a multilingual, multi-generational population. It is deeply important for me that our most underserved and at-risk populations are provided with testing and vaccination information in ways that they can understand and at locations they can access. For over a year now, through increased access to testing and now through our vaccination effort, Orange County has focused on addressing equity. Even after the pandemic, we will continue this renewed focus on issues of equity in our communities. In late June of 2020, when the evidence became clear about the increased level of COVID-19 infection in the Latino community, Supervisor Chafee and I, who represent Orange County's Testing and Vaccine Ad Hoc Committee, announced the launch of the Latino Health Equity Initiative to eliminate barriers that kept Latino residents from accessing vital COVID-19 related information. That summer, we also worked together and directed the Orange County Healthcare Agency to develop the API Task Force to expand COVID-19 testing to the Asian Pacific Islander communities. As soon as we began receiving vaccines from the state, the county set to work getting them in arms as quickly and equitably as possible. To reach Orange County Healthcare Agency's goal of vaccinating our Orange County residents by July 4th of this year, the county developed Othina, an app to schedule vaccine appointments to those eligible under the state tiers. Since the opening of the first vaccine super pod at Disneyland on January 13 this year, the county has opened a super pod at Soka University and at Anaheim Convention Center. We also have a number of equity sites, including the ones at Santa Ana College and Christ Cathedral. Several other mobile pods have been conducted in the hardest to reach parts of the county, primarily in Santa Ana and Anaheim, our two most affected cities. I encourage everyone to take the time to register on othina.com to get notified when it's your turn to get vaccinated. And for those who have no access to the internet, you can call the COVID-19 hotline at 714-834-2000. There are also many other ways people can get access to a vaccine, through their primary health provider and even at their local pharmacy. Of course, until we meet the vaccination levels, our health experts recommend we must continue to practice good hygiene. Masks work, ventilation works, distancing works. I know it is tempting to let your guard down now that we are well into vaccinations. However, we cannot afford to let up now and lose progress. With every dose given, there is less likelihood of community transmission of this destructive virus that already has taken away so much from us. If we truly want to return to our lives, we must see this fight through to its conclusion with the same tenacity and perseverance as we have endured. Ultimately, I see the light at the end of the tunnel and am full of hope for our collective future. Thank you.
Thank you, Supervisor Andrew Dee, who spoke of the challenges for the OC residents to be vaccinated and to have everybody vaccinated by July 4th by opening super pods throughout the county and the work that's being done for that. He encouraged all community members to get vaccinated and to not let your guard down. And finally, he has the hope that we have the tenacity to move through this. Before we finish up, I want to go back to Dave Elliott, who's going to talk briefly, if you would, Dave, about the Influential Leadership Breakfast Series.
Sure, Sean, thank you. And thank you to all of our presenters. You know, these are outstanding leaders in our community. And I think our community is in great hands with the leaders that were with us today. And so I want to thank them as well as Sean and your team again. And for those that are listening in today, thank you for taking the time to be, hopefully, more informed about what's going on here in our Orange County community. I did want to mention one more, again, our event coming up through the Institute and the Paskey's Foundation is our Influential Leadership Breakfast Series. We have 4 of these this year. One we already had, and we have one coming up on May 5th, where we'll be presenting the Latino Youth Academy. And it's a working breakfast. We encourage you to sign up to be a part of that. It's a good little networking opportunity, but more than that, it is an opportunity to really listen to and hear from the Latino Youth Academy and to weigh in on some issues that they're dealing with, where we can use your expertise and connections. I see, and Drake Levishah from Azusa Pacific University is our host. So I just encourage you to go to our website. I think there might be a link in the notes to go and sign up for that May 5th event. So thank you, Sean, again for hosting our second annual very informational forum on what's going on here in Orange County. Thank you.
And Dave, it was my pleasure to do so. We look forward to participating in the breakfast as well and doing this again next year. Again, it is a snapshot in time of what's happening for us right now. We know things are changing quickly, so we appreciate your attention today. We will post this on YouTube sometime this afternoon so that you could share it with others.
And
Dave,
Sean, if I could just say one more shout out to Bank of America for sponsoring our event today, to Sherry Battle, Lisa Sims. Again, thank you for the sponsorship of the forum today.
Thank you, Bank of America. And thank you again to all of you. Have a wonderful day. Bye-bye.
Bye now.